Yeah,
Good
well,
evening, sir.
Mr. Concepcion, I'm sure you saw the statement of Mr. Ghebreyesus from the WHO. What were your impressions? What were your initial thoughts hearing this from the WHO, allowing themselves a little bit of optimism?
Well, it's good that we're moving forward. Hopefully, our medical doctors are able to see that same light. No, and I created this advisory council of experts. So we normally have a lively discussion with our doctors who have advised us quite well. And of course, the issue on mandatory masking and its removal is something that they don't agree. No, but as you know, our view has been that it's about time.
But when the
You use the
WHO says,
word hopefully. I, yeah, you use the word hopefully, no? So, do I take it that from your point of view, our doctors here are even more conservative than the World Health Organization, or are they more cautious?
Well, yeah, some of them are, and I understand their concern is basically that their doctors, they are concerned with their patients and they want to make sure that they are safe. No? But on the other hand, I think we realized in the last 2 years and that how to live with COVID, and some people will get sick. It's a matter of level of risk that one wants to take. No? What has happened is that the mandate on vaccine has been removed, and now the mandate on mask has been removed for outdoors. No? So it is not masking that is removed, it is just the mandate, giving more people the freedom of choice. No? Right now, even if we want to drag the people to the vaccination centers for boosters, it's going to be a struggle. And they made a decision. Some of them just don't want to take the boosters because they think they can withstand Omicron, which is mild, and just go through it and develop natural immunity. So you can't force people when they don't want to do it. So we have to really move on and accept the fact that there are some people who would like to take that risk. And of course, there are others who will not take that risk. No? So I think, and I'm glad that WHO has made that statement, and that will really strengthen the position that we really have to move on. No? It's about time.
There are proposals now to regularize or normalize the hybrid system of working. I mean, yung paghahalo ng work from home and on-site reporting. What do you think of those proposals? Some are saying na dapat daw 3 days out of the week or 2 days. What do you think of that?
I hope we don't do that, because the moment you start to get everybody to work more from home, then you reduce mobility, no? And when you reduce mobility, then that's less economic activity, because remember, these our employees go to work, they ride the public transportation, they ride a tricycle, angkas, and all of that. So these people are in that business. They eat in a carinderia, and a canteen, a cafeteria. So we need mobility. We need people to go out and spend. No? The moment people stop spending, then our economy will really slow down. So it's a balance. I understand that. And in fact, the Jobs Committee proposed that maybe leave it up to 70-30. But others feel that let the owners decide. For example, in manufacturing firms, we cannot make our people work from home. No, they have to be in the factories, running the equipments and all of that, our R&D, our staff. So it depends on the business that we have. No, maybe the BPOs, yes, but I think they should somehow cap it. No, because if all of them start to work from home, that's a huge number. No, and all these buildings that they were once in, they will be empty, and you will see things slow down. So I think school is great. It has opened, and it's psychological. The kids not being in school was very challenging. So that is also going to create more economic activity, and that's what we want to see. We want to see people to move, to travel, to go out, to dine in, to eat in restaurants, we have to. That's why I'm saying we have to move forward, and and people are learning how to do it.